Our community of nurse health information management professionals wanted to highlight efforts to increase CDI awareness in nursing programs. These have begun as some nursing programs include at least 1 to 2 lectures on documentation's impact on quality metrics, data analytics, and reimbursement, often taught by guest CDS professionals. Electronic health record, EHR, training. As EHRs integrate CDI tools, for example, AI-assisted coding prompts, students learn how documentation triggers system alerts. Emphasis on specificity. Programs increasingly stress precise language, such as the difference between the diagnosis and plan of care for an acute stroke versus one-sided weakness following a stroke, which aligns with CDI needs. Certifications. Some healthcare organizations are now offering CDI training for nurses interested in transitioning to the role, filling the gap left by academia. If you are interested in learning how to advance your nursing career by leveraging your nursing knowledge in a non-traditional role, enroll in our transition coaching program and download a free copy of our My Transition Journal today.
We want to hear from you. Schedule a free consultation or send us an email at advancednurses@acd4n.com or visit our websites www.advancednurses.info or www.acd4n.com.